ನನ್ನ ಹೆಸರು ಸುಮಾ ಅಂತೇಳಿ. ನಾವಿರೋದು ಇವಾಗ ಬೆಂಗಳೂರು ಸಿಂಗ್ಸಂದ್ರದಲ್ಲಿದ್ದೀವಿ. ನನಗೆ ಇವಾಗ ಮದುವೆಯಾಗಿ 3 ವರ್ಷ ಆಗ್ತಾಯಿದೆ. ಇದೇ ಫಸ್ಟ್ ಪಾಪು ಇದೆ ನಮಗೆ. ನಾವು ಬೇರೆ ಕಡೆ ತೋರಿಸಿದಾಗ ಸಿಸರಿನ್ ಮಾಡಬೇಕು ಅಂತಂದ್ವಿ. ಸಿಸರಿನ್ ಮಾಡಬೇಕಲ್ವಾ, ದುಡ್ಡು ತುಂಬ ಖರ್ಚಾಗುತ್ತೆ ಅಂದ್ಕೊಂಡ್ವಿ. ಬೇರೆ ನಮ್ಮನೆ ಹತ್ರನೇ ಒಂದು ಪ್ರೈವೇಟ್ ಹಾಸ್ಪಿಟಲ್ ಇತ್ತು, ಅಲ್ಲಿ ತೋರಿಸ್ತಾ ಇದ್ವಿ. ಅಂದರೆ ರೆಗ್ಯುಲರ್ ಚೆಕಪ್ ಅಂದರೆ ಫಸ್ಟ್ ನಾನು ಕನ್ಸೀವ್ ಆಗಿದ್ದು ಸುತ್ತಲೂ ಅಲ್ಲೇ ಹೋಗ್ತಾಯಿದ್ವಿ. ಅವರು ಬರೀ ಅದೊಂದು ಚಿಕ್ಕ ಕ್ಲಿನಿಕ್ ಥರ ಇದೆ, ನಾವು ಬೇರೆ ಕಡೆ ರೆಫರ್ ಮಾಡ್ತೀವಿ, ತುಂಬ ದುಡ್ಡು ಖರ್ಚಾಗುತ್ತೆ ಅಂತ ಹೇಳಿದರು. ಆಮೇಲೆ ನಾವು ಏನು ಮಾಡೋದು ಅಂತ ಅನ್ನುವಷ್ಟರಲ್ಲಿ ಈ ಸ್ಪೆಷಲಿಸ್ಟ್ ಹಾಸ್ಪಿಟಲಿಂದ ಫೋನ್ ಬಂದು ಮಾಡಿಕೊಡ್ತೀವಿ ಅಂತ ಹೇಳಿದರು. ಹಂಗಾಗಿ ತುಂಬ ಖುಷಿ ಆಯಿತು. ನಮ್ಮ ಪಾಪು ಲಕ್ಕಿ ಅಂತಲೇ ಹೇಳ್ಬೋದು. ಆಮೇಲೆ ಸ್ಪೆಷಲಿಸ್ಟ್ ಹಾಸ್ಪಿಟಲಿಂದ ಫೋನ್ ಬಂದಿತ್ತು. ಆಮೇಲೆ ಫೋನ್ ಬಂದಮೇಲೆ ಬನ್ನಿ ಹಾಸ್ಪಿಟಲಿಗೆ ಅಂತ ಹೇಳಿದರು. ಬಂದು ಫಸ್ಟ್ ಟೈಮ್ ಚೆಕಪ್ ಮಾಡಿಸಿದ್ವಿ. ಆವಾಗ ಮಮತಾ ಮೇಡಮು ಬಂದಿದ್ದರು. ಮಮತಾ ಮೇಡಮ್ ಬಂದು ನನಗೆ ಕಾಲ್ ಮಾಡಿ, ಅಲ್ಲಿ ಹೊರಗಡೆ ಕೂತ್ಕೊಂಡು ಕಾಲ್ ಮಾಡಿ ಒಳಗಡೆ ಎಲ್ಲ ಕರ್ಕೊಂಬಂದು ಡಾಕ್ಟರ್ನ ಮೀಟ್ ಮಾಡಿಸಿ, ಆಮೇಲೆ ಡಾಕ್ಟರ್ ಹೇಳಿದರು ನಾನು ನಿಮ್ಮ ಕೇಸ್ ತೊಗೊತೀವಿ, ಮಾಡಿಕೊಡ್ತೀವಿ ಅಂತ ಹೇಳಿದರು. ಆಮೇಲೆ ಆವತ್ತು ಚೆಕಪ್ ಮಾಡಿ ಆಮೇಲೆ ಮತ್ತೆ ಹೊರಗಡೆ ಬಂದಮೇಲೆ ಮಮತಾ ಮೇಡಮ್ ಏನು ಕೇಳಿದರು ಏನು ಅಂತ ಹೇಳಿ, ತೊಗೊತೀವಿ ಕೇಸ್ ನಾವು ಮಾಡಿಕೊಡ್ತೀವಿ ಯಾವ ಸಿಸರಿನ್ ಅಂತ ಹೇಳಿದರು. ಅದಾದಮೇಲೆ ನಿಮಗೆ ಅವಾಗ ನಾನು ಇಲ್ಲಿಗೆ ಬಂದಾಗ ನಂಗೆ ಸ್ವಲ್ಪ ಒಂದು ಆಗಿತ್ತಲ್ಲ ದಿನಗಳು, ಅಂದರೆ ಒಂದು 6 ಮಂತ್ ಮೇಲಾಗಿತ್ತು. ಹಂಗಾಗಿ ನಿಮಗೆ ಯಾವಾಗಾದರೂ ಪೇನ್ ಬಂದರೆ ಸಪೋಸ್ ಏನಾದರೂ ಇಮ್ಮಿಡಿಯೇಟ್ಲಿ ನಿಮಗೆ ಹುಷಾರಿಲ್ದಂಗೆ ಆಯಿತು, ಹೊಟ್ಟೆ ನೋವೇನಾರು ಕಾಣಿಸ್ಕೊಂತು ಅಂತಂದರೆ ಮಮತಾ ಮ್ಯಾಮ್ ನಂಬರ್ ತೊಗೊಳ್ಳಿ, ಮತ್ತು ಡಾಕ್ಟರ್ ಉಷಾ ಮೇಡಮ್ ನಂಬರ್ ತೊಗೊಳ್ಳಿ. ಆಂಬುಲೆನ್ಸ್ಗೆ ಅಲ್ಲಿಗೆ ಫೋನ್ ಮಾಡಿ, ನಾವು ಆಂಬುಲೆನ್ಸನ್ನು ಫ್ರೀಯಾಗಿ ಕಳಿಸ್ತೀವಿ ನಿಮ್ಮ ಮನೆ ಕಡೆನೇ ಅಂತ ಹೇಳಿದರು. ಆಗ ಅಲ್ಲಿಗೆ ಆಮೇಲೆ ಅದೆಲ್ಲ ನಂಬರ್ ಇಸ್ಕೊಂಡು ಬಂದಮೇಲೆ ನೆಕ್ಸ್ಟ್ ಬರುವಾಗೂ ನಾವು ಮೇಡಮ್ಗೆ ಫೋನ್ ಮಾಡ್ಕೊತಾನೆ ಬಂದ್ವಿ. ಮಮತಾ ಮೇಡಮ್ ಫೋನ್ ಮಾಡ್ಕೊಂಡು ಬಂದಮೇಲೆ ಅವರು ಕೇಳಿದರು. ಆಮೇಲೆ ಮ್ಯಾಮ್ ಮತ್ತೆ ದುಡ್ಡು ಏನಾರು ತೊಗೊತೀರಾ ಅಂತ ಕೇಳಿದ್ದಕ್ಕೆ ಇಲ್ಲ, 1 ರೂಪಾಯಿನೂ ನಿಮ್ಮ ಹತ್ರ ದುಡ್ಡು ತೊಗೊಳಲ್ಲ ಅಂತಂದರು. ಅದೇ ರೀತಿ 1 ರೂಪಾಯಿನೂ ನಮ್ಮ ಹತ್ರ ದುಡ್ಡು ತೊಗೊಂಡೇ ಇಲ್ಲ. ತುಂಬ ಚೆನ್ನಾಗಿ ನೋಡ್ಕೊಂಡಿದ್ದಾರೆ. ನನಗೆ ಶನಿವಾರ ದಿನ ಆಗಿದೆ, 25ಗೆ ಆಗಿದೆ. ಅದರಲ್ಲಿ ಆವಾಗ ಕ್ರಿಸ್ಮಸ್ ಇರೋದ್ರಿಂದ ನಾನು ಅವಾಗೇ ಆಗಬೇಕು ಅಂತ ಕೇಳಿದೆ. ಲಾಸ್ಟ್ ಸ್ಕ್ಯಾನ್ ಮಾಡಿದಾಗ ಅವ್ರು ಕೇಳಿದರು, ಮಗು ಪರವಾಗಿಲ್ಲ ಬೆಳೆದಿದೆ, ಎಷ್ಟಿರ್ಬೋದು, 37 ವೀಕ್ಸ್ ಆಗಿದೆ ಅಂತ ಹೇಳಿದರು. ಹಾಗಾಗಿ ನನಗೂ ಸ್ವಲ್ಪ ಹೊಟ್ಟೆ ಕಷ್ಟ ಆಗ್ತಾಯಿತ್ತು. ಮೇಡಮ್ ಇವಾಗ ಮಾಡ್ತೀರಾ ಅನ್ನೋದಕ್ಕೆ ನಿನಗೆ ಯಾವಾಗ ಹೇಳಮ್ಮ ಆವಾಗ ಮಾಡಿಕೊಡ್ತೀವಿ ಅಂತ ಹೇಳಿದರು. ಕ್ರಿಸ್ಮಸ್ ಅವತ್ತೇ ಬೇಕು ಅಂದ್ಕೊಂಡಿದ್ದೆ, ಅವತ್ತೇ ಆಯಿತು ನನಗೆ. ನಮ್ಮ ಪಾಪುಗೆ ಬಂದು ಮೋ ಅನ್ನೋ ಇದರಲ್ಲಿ ಬಂದಿದೆ. ನಾವು ಕೇಳಿಸಿದ್ವಿ ಪಾಪುಗೆ ಹುಟ್ಟಿದ ಡೇಟ್ ಎಲ್ಲ ನೋಡಿದ್ಮೇಲೆ ಅದರಲ್ಲಿ ಮೋ ಅಂತ ಬಂದಿರೋದ್ರಿಂದ ನನಗೆ ಮೋಕ್ಷ ಅನ್ನೋದು ಹೆಸರು ಇಷ್ಟ ಆಗಿದೆ. ಸೊ ಅದೇ ಕರಿಬೇಕು ಅಂದ್ಕೊಂಡಿದ್ದೀನಿ. ಸೊ ಇಲ್ಲಿರೋ ಅಂಥ ಎಲ್ಲರಿಗೂ ಥ್ಯಾಂಕ್ಸ್ ಹೇಳೋಕ್ಕೆ ಇಷ್ಟಪಡ್ತೀನಿ.
So we came to know through media, and we took up this case on 2 major bases. One is on humanity basis, and second is giving back something to the society. So I called up Miss Suma and her husband. I told her, like, we would like to treat you at our hospital. If you're willing, you can please come and consult a doctor once. And they had a consultation with Dr. Usha madam. And after the consultation, Dr. Usha told that yes, it's a challenging case with all such atypical deformities. We'll take up this case. And then I spoke to both husband and wife, that is Suma and Suma's husband, and told them, like, we are willing to take up this case. How about your willingness? So they also said, ma'am, we are happy. We would also like to come and get treated at specialist hospital. So they came and got themselves admitted at 24th Christmas Eve, and 25th morning she was delivered with a beautiful nightingale, a girl baby she was delivered. And today the time is arrived where Suma and a little nightingale is getting discharged, and with hale and healthy, both mother and child are doing absolutely great, and it's a happiest moment for both the families. One is Suma's family as well as our specialist family.
I am Dr. Raj Lakshmi, Senior Consultant Anesthesiologist, Department of Anesthesia, Specialist Hospital. We received patient name Mrs. Suma, age 34 years, primigravida, who had come with term gestation for safe confinement of her baby. So she was a difficult patient than our rather normal cases that come to us for lower segment cesarean section, because she had inherited polio during her childhood period, and she had post-polio residual paralysis that is paralysis of the limb that happens because of polio, and she had developed bent in the spine because of the after effects of the residual paralysis of polio. So we call it as scoliosis, and she had undergone multiple corrective surgeries for it, which were failed. So when she came to us, she had a bent spine, and due to all the anatomical changes that happened to her because of the problems, she could not go in for a normal delivery. So she had come for a pre-anesthetic evaluation to us. When we evaluated her, we further analyzed and assessed that her lung fields had moderate to severe restriction, and she had a very deformed spine. So normally for a lower segment cesarean section, we would prefer to give spinal anesthesia. But in her case, what was different was her spines were totally deformed, and because of the multiple failed corrective surgeries, we could not figure out the midline for positioning the needle. So we had planned to take her up under an elective general anesthesia, which is also not normal for a lower segment cesarean section. The preferred technique would be regional in them, but in her case, because it was difficult spinal, we had to weighing benefits over risk, we had to take her up under general anesthesia. We had kept the family prepared, and we had also made a special arrangement for her in terms of making a specialized team to deal with her, including anesthesiologist, neonatologist, pediatrician, intensivist, and the surgeons. So we met her a week before the surgery, that is, she was expected to be taken up as an elective cesarean section on 25th of December, that's on Christmas Day. So 1 week before, we analyzed her, investigated her, assessed, and we were planned to take her up on 25th. So on the day of surgery, we had prepared her up by giving anti-aspiration prophylaxis, and we took her up into the theatre. Elective general anesthesia was given to her. She was induced, intubated successfully. Live female baby was extracted on 9:24 a.m. on the day of Christmas. The procedure went uneventful. We reversed extubated the mother, and post-op in the recovery she was doing fine without any after effects of the residual paralysis or in desaturation. She was kept in our post-anesthesia care unit, and once she was hemodynamically stable, we shifted her back to the ward. So the whole procedure went on uneventful. She was a challenging case for us, but with the grace of God, everything went on fine, and thanks to the whole team who had to deal with her.
Mrs. Suma, 34-year-old primary gravida, was booked to us at specialist on 25th of November at 32 plus 4 weeks period of gestation. She was not a normal patient. She is very different with lot of ailments. She had post-polio residual palsy of the right leg and also had scoliosis. She had undergone a lot of spinal surgeries, corrective surgeries way back in 2010, which was not very successful. She had regular antenatal checkup elsewhere, which were all uneventful. She had carried the baby almost till 32 weeks without any untoward complication. For us as an obstetrician, carrying forward from 32 weeks until term was a bigger challenge, because the size of the uterus being very, very small here, and the spine being deviated completely to one side. The uterus was almost shifted to the left side, so it was almost like a unicornuate uterus, we could tell. So we carried forward the pregnancy with a good team of, we had to make sure that the baby was getting adequate nutrition inside, so we did scans to ensure that the baby's growth was adequate, the liquor was adequate. We also had to ensure that she had to undergo an elective cesarean section here, because her pelvis being tilted, she could not undergo a normal delivery. The pelvis would be completely deformed in these cases, so we had to do an elective cesarean section. Keeping in term the baby being small for gestational age, we had to keep ready the NICU, the neonatologist, and of course the more challenging aspect here was for the anesthetist. Regional anesthesia was very, very doubtful, because the spine was definitely not in the midline. To get into a spinal would be a very difficult task. Secondly, with the pregnancy, the uterus being shifted upwards, and all her cardiac and pulmonary functions were also compromised, because her space itself was very, very narrow for all the organs here. So it was a challenging task, I think more so for the anesthetist. Of course, for us, as the patient had to undergo a C-section under general anesthesia, yes, the risk of general anesthesia, uterine atonicity and PPH was definitely there with us. When she was 37 weeks, we decided to go ahead with an elective C-section, because the patient also felt carrying the baby and walking independently was little difficult for her. With carrying a baby, term baby, to do her day-to-day routine activities become a bigger challenge for her. So we had to go ahead with the elective C-section, keeping things ready, especially the OT, then the post-op recovery, because she would need prolonged anesthesia, because in case she goes into general anesthesia, the pulmonary function being reduced, she would have required prolonged ventilation. Keeping in that, our team was ready, and we had successful C-section, uneventful cesarean section. She delivered a girl baby, 2.04 kgs, all uneventful. The baby and the mother are doing fine.
ಸುಮಾ ಅವರ ಹಸ್ಬೆಂಡು ನಮಗೆ ಇಲ್ಲಿಂದ ಹಾಸ್ಪಿಟ್ಲಿಂದ ಫೋನ್ ಬಂತು, ಅದಕ್ಕೆ ಸುಮಾ ಮೇಡಮ್ ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡಿದ್ವಿ. ಹಾಗಾಗಿ ಅವರು ಸ್ವಲ್ಪ ಹೆಲ್ಪ್ ಮಾಡಿ ಪ್ರೈವೇಟ್ ಹಾಸ್ಪಿಟಲ್ ಮೇಡಮ್ ಅವರು ಇವರು ಕಾಲ್ ಮಾಡಿದರು, ಇಲ್ಲಿಂದ ಫೋನ್ ಮಾಡಿದಾಗ ಇಲ್ಲಿ ಬಂದು ತೋರಿಸಿವು. ಬಹುಶಃ ಮೇಡಮ್ ಸ್ವಲ್ಪ ಕೇರ್ ತೊಗೊಂಡು ನಾವು ಫ್ರೀಯಾಗಿ ಮಾಡ್ತೀವಿ ಅಂತ ಹೇಳಿ ಕರೆಸ್ಕೊಟ್ಟಿದ್ದಾರೆ. ಬಹುಶಃ ತುಂಬ ಖುಷಿಯಾಗಿದೆ. ಅದಕ್ಕೆ ಹಾಸ್ಪಿಟ್ಲಿಗೋಸ್ಕರ ಧನ್ಯವಾದ.